Good morning, world. Good morning, world. Good morning, Nigeria. Good morning, Lagos. It's up your clock. And welcome to today's episode of Up You with Ezinne. How you all doing? I've missed all of you absolutely. It's so good to be here. Today we are marking World Cancer Day with a very special focus on closing the gap in cancer treatment. Specifically how combining medical treatment with emotional and psychological support can create better outcomes for patients. I believe this is an important conversation for anyone impacted by cancer, whether directly or indirectly. My name is Ezinne Kufrekanem, and I'm your host. As always, I'm here to empower and uplift. Today's show is special because our guest is none other than Dr. Adewumi Alabi, consultant clinical and radiation oncologist at NSIA-LUTH Cancer Centre. She will be sharing invaluable insights on how a holistic approach encompassing both advanced medical care and emotional support can help close the gap in cancer care. You all know I'm big on caregiving, you know. So stay with me as we dig deeper into the subject. You're welcome. As you join the stream, please settle in, share, invite every woman you know. Every man also indeed should come in and listen to this very important conversation. Like we all know, October is the Breast Cancer Awareness Month, but we're generally talking about every kind of cancer today with specific, um, emphasis on cancer as well. We will be discussing closing the care gap, integrating medical treatment with emotional and psychological support in cancer care. So please get comfortable, share this live stream, and let's explore the holistic way to care for cancer patients. It doesn't always have to end up in negatives. We should be able to get some positive results from this sort of situations if they do occur to us. We are live on YouTube and Instagram right now, so don't forget to follow at Up You with Ezinne on all our platforms to keep this conversation going even after the show has ended. We love to hear from you, so be sure to also share and wide. So it's time to bring up our guest today. I told you guys that she is one of the best. As I read you, Dr. Adewumi Alabi is a fellow of the West African College of Surgeons and the International Atomic Energy Agency. She's a member of the African Organization on Research and Training in Cancer, the American Society of Clinical Oncology, Prostate Cancer Transatlantic. 1 minute. I will just give me a minute. Let me sort something out and I will be back to read. Because this bio needs. Okay. So I'm back and I'm starting all over. Dr. Adewumi Alabi is a fellow of the West African College of Surgeons and the International Atomic Energy Agency. She is a member of the African Organization in Research and Training in Cancer, the American Society of Clinical Oncology, the Prostate Cancer Transatlantic Consortium, the International Psycho-Oncology Society, and the Association of Clinical and Radiation Oncologists in Nigeria. Dr. Alabi is not only a clinician, but also a researcher and an educator. She has published numerous papers in reputable journals and presented at various national and international conferences. Dr. Alabi has, over the years, distinguished herself and has become a go to specialist in the treatment of breast cancer and sarcomas. Welcome, Dr. Alabi. Thank you for joining us today on Up You with Ezinne. How are you?
Thank you. Good morning, Ezinne. And thank you, viewers, for joining in. Okay. Is it from my end?
Interesting.
Is it blurring?
What did you say, ma'am?
The audio isn't sounding, so it's sounding with some echoes. Is it okay from you, from your end?
Yes, it's okay from my end. I can hear the echoes, but it's quite all right. It will
Okay.
disappear.
All right. Thank you. Thank you for having me.
You're very welcome. I am still blown away and in kind of some awe. I didn't know. How did you read all of this? I mean, hello,
Thank God.
hello.
Thank
This
God for
is
all of
this is intimidating.
it.
This is intimidating.
Thank
And then
God.
I didn't even know there were all this. I'm sure that everybody here is wondering. So cancer has all of this. Okay, all right. So we're in for a good one today. Obviously, everyone, you can be sure that we're in for a good one. Dr. Alabi, it is my pleasure to have you on the show. Let
Thank you.
us
Thank
start
you
by
for having
you
me.
telling us in very layman, as if we didn't even go to school at all, what is cancer?
Okay. So cancer is a terminology that a word that we use when there's an abnormal growth in one part of the body. So it could be, some people will call it lump, some people will call it swelling. So, but you just know that there's something strange in this part of the body that never used to be there. And sometimes you can have a swelling or a lump that is normal. Okay, we call that one benign. So just a normal lump. But when a lump is now there in any part of your body and has the ability to leave that place and go to another part of the body, causing harm as it does so, becomes cancer. And so we call it malignant. Okay, that means it has the potential to leave that part of the body where it is, causing harm in that same part, and also able to go and cause harm or damage in other parts of the body. So that's the layman's way of describing what cancer is. So it's an abnormal growth that keeps growing, keeps getting bigger, causes a lot of discomfort, makes the person uncomfortable, and can actually even take the life of the individual. So that's what cancer is.
Thank you very much for this. I learned from it because, most of the times we hear things like, oh, it doesn't get detected. Oh, he was found at stage 3 or stage 4 or that and that. But you see, your
Exactly.
explanation now just makes it easy for someone like me to understand. And I hope for a lot of people on the stream. Cancer
Yeah,
is an abnormal growth.
it's an
When you
abnormal.
find something that wasn't there before in your body, don't just say it is there. Oh. Please go and do what? Check. Mm? As I'm talking to you, I'm talking to myself. Just go and check. And for us women, October is all about breast cancer. And as you
Exactly.
can imagine, you need to go do all your tests and be sure that there is no lump, no growth
Anywhere in your body, in your
anywhere in your breast. By now, I'm sure there are a lot of programs going on, and we have all been taught how to do the breast cancer self examination and all of that. Doc may talk on it if she feels like, but um, the truth is, we've heard it now, it is a growth. And especially if you find it somewhere and it moves, once it has gone to the point of moving from one point to another, please start looking for Dr. Alabi like your
Oh,
life
so,
depends
so
on
so
it.
another thing about it is that you will not know it's moving because it's going to go through the blood. And so you may not even know it's moving. And so that's why you should not keep quiet when you see an abnormal growth or swelling in your body because you will not know it's moving, you will not know it has left that place until you do some tests or investigations before you can know.
Thank you, Doc. When we finish this show, I'll tell you why I'm shaking my head. Okay, so this morning our focus is on the theme for this year, uh, Cancer Awareness Month, which is closing the care gap. All right. So please, could you tell us what it means? What can you explain what closing the care gap means in the context of cancer care,
Okay.
especially in Nigeria?
So this is how it goes. Okay. Closing the care gap is the theme for the World Cancer Day.
Mm-hmm.
Every February 4th, we have all over the world globally, we have a theme. And whatever that theme is becomes what we all nations of the world should work towards. And that is where close the care gap comes in. And so the theme for the breast cancer awareness month, for the month of October for this year, is that no woman should face breast cancer alone.
Alone.
Okay, so we have two themes now, closing the care gap, and then we have no woman should face breast cancer alone, meaning that woman should not be left alone, should have all the support, whether from the family, from the spouse, from the children, from the government, from the doctors, from the healthcare givers, from everywhere in every capacity. No woman should have to face breast cancer alone. So that's our theme for the Breast Cancer Awareness Month. But it's also taken from the global theme for the for the World Cancer Day, which means close the care gap. And so the close the care gap just means that we want to make sure that every individual has access to healthcare. Healthcare means you have access to go for prevention, get to the hospital and being told what you need to do to prevent cancer, get access to early detection. What are those tests that needs to be done? Okay, prevention, maybe immunization, vaccines, what you need to do to prevent. So because some cancers are actually preventable. And then, so we want to talk about early detection. How soon can this cancer be discovered? What are those things that this woman needs to do? And then, how is the diagnosis made? In some parts of the world, some diagnosis can be made within seconds. Why is it in Africa we have to use 3 weeks to get a diagnosis of cancer? And then, what to talk about treatment? Outside Nigeria, in the Western world, they have access to very sophisticated treatments that can make the cancer disappear within a week or two. So we want to have that also in Nigeria, in every country of the world. So we want to make sure we close the care gap to make sure that healthcare is available, affordable, quality healthcare. So the kind of care the woman who is in the US gets is the kind of care the woman who is in Nigeria should get. The kind of care wherever you are in the world is the kind of care we want everybody to get. So we want to close that gap. We don't want there to be disparity. We don't want there to be, oh, because she's black, she's of the black race, she does not deserve to have the best. No, we want everybody to have equal opportunity. And so that is the gap we are closing. We want to make sure that whatever clinical trials they are doing over there that will benefit their people and make them have access to free healthcare, we want that to also be done in our nation, in our country, wherever the woman is. Even if in the village she is, we want her to get that care. So that's what closing the care gap is all about.
Thank you. I hear you. It sounds pretty in theory,
Yeah.
but practically today in Nigeria, what does cancer care look like? Can we really close this gap?
So closing the gap stems from every one of us. Okay. Remember that I have just talked about prevention, early detection. If the woman that lives in her house that saw a lump doesn't come out, Dr. Alabi cannot help the woman. The government cannot help the woman. Nobody can help the woman. So it comes about awareness, advocacy. So that is how the gap starts getting being closed. So someone like Ezinne needs to go out there and tell the women on the street, did you find a lump in your breast last month and you're still at home? Can you please go to the hospital? So, because when that woman comes to the hospital, then it is Dr. Alabi's responsibility to make sure that the kind of care she would have gotten if she traveled out of Nigeria is the kind of care she will still get if she's in Nigeria. It's Dr. Alabi's responsibility to tell the government and let them know, and stakeholders like Ezinne, NGOs, people around who are in the cancer space, who will also make voices and go to the government and say, we need this drug for this category of women that have breast cancer. It's expensive, they cannot afford it. Government, you must do something. So you see that we can actually close the gap. If we all put hands together and make efforts to make this work, then we can close the gap. We may not be able to close the gap this year. We may not be able to close the gap tomorrow, but in a few years down the line, this gap will definitely be closed, such that we will have accessible healthcare, affordable healthcare that people can boast of and say, oh, we got treated 20 years ago, 30 years ago, and they are still doing fine. So this care gap can actually be closed. It's something that is a work in progress, but it stems from everybody coming together to say, let us rise up to the occasion and close this care gap.
Thank you. And what you've said now is very significant because the silence culture, it's it's a very huge thing in this our society. Someone has cancer and the person is even hiding it. You hear things like, my enemy, they say my enemy has, or I
Okay,
refuse
as
to,
an
I refuse
arrow,
to
an
name it.
evil arrow.
Or exactly, I somebody sent an evil arrow to me. And these are things that actually, um if we were open and sought help on time, all things being equal, we could recover and go on to
Exactly.
live meaningful lives. Okay,
Yeah.
there's a question here too early, very early, not too early, sorry, very early question coming in from Josephine Oba. He says, please, what does it mean when they say it is a painless growth? Can you give an insight into this?
Yeah. So cancer most often times does not cause pain when it starts. In fact, if at all anything, when you begin to have pain, then there's trouble, there's problem. Okay, that means it has grown beyond what it should before it causes pain. And why we often say it's a painless growth, because when the woman comes to us and maybe the lump has become, as maybe it started as a bean seed, or the seed of agbalumo. Let me give example. It started as a seed of agbalumo. She saw it and she said it wasn't paining her, and then she waits for it, became like the size of agbalumo itself, and then it now becomes the size of an orange, and then the skin gives way and becomes a wound. Then she will come to the hospital and say, oh doctor, this wound has refused to grow after she has treated and treated. And you will now ask questions and say, it didn't just become a wound in a day. How did it start? She said, oh, initially it started very small, and it was just growing, but since it wasn't paining her, she felt there was no need to come to the hospital. So that's usually the mistake people make with cancer. So when they see a swelling or a lump, whichever name what they want to call it, and they feel that, oh, it's not getting bigger, it may not even be getting bigger like that. Oh, it's been there for 2 years, and she didn't think it was anything serious. That's because it wasn't paining her, and that's most ways cancers present. That's the most way cancers present. It presents as painless lump. So that's why we say, but it's not every painless lump that is cancer. But you cannot know because you are not the doctor. So if you have a painless lump somewhere in your body, why don't you get to the hospital and let them check and tell you it is normal? Don't worry about it. Or even if they say it's normal, because some people, we also have to help people to move away from going to doctors or healthcare people that don't really know what they are doing. Okay, so we have a lot of that mistake people fall into such hands, such that, oh, they said they went to a chemist and showed somebody, and the person said, see, it's not injury, it's not paining you, just don't worry, it will go. Okay, so but make sure you go to a reputable place where you are sure that they've done the right thing. Or if you see that, or you went there and it's getting bigger and they're still telling you not to disturb yourself, it's nothing. Look for another person and seek a second opinion. We must move away from those era where you just sit at home, somebody told you it's nothing to worry about, and then you did not worry about it, and then it becomes cancerous, and then it becomes a problem for you later in life. So it can be painless. Most often times it is painless. And so we want you to come to the hospital to have a good check so that we can tell you whether it is the kind of painless one you should worry about or the one you shouldn't worry about.
Thank you very much. So, painless can be deceptive. Please have it
Exactly.
checked out. Thank you for that very brilliant question, Josephine. Moving on, please could you share with us from your experience some of the significant challenges cancer patients face in assessing treatment?
Okay. So I think I've talked about one of them already. That's the fact that they don't know where to go, going to the wrong places, and
Mm,
you keep going to the wrong place. You're not getting results. You still stay there. You say, the doctor I've been using since my childhood, and you are still staying there. So if you're not getting results, you must learn when to say, I need to have a second opinion. So that's one. Um, so access to care is also a problem. So when I mean access to care, not everybody knows how to manage cancer. Okay. So if you are a woman out there and you go to a doctor and then you say you have a lump, and the first thing the doctor wants to do is to remove the lump, please run away from that doctor. That should not be the first thing the doctor would do. Removing the lump is not the first thing. The doctor needs to do some investigations, even if it is an ultrasound. He needs to take a biopsy, even if it's just a small needle biopsy, to know what kind of lump he's going to be dealing with. So a doctor should not just remove a lump and tell you, and then some doctors will even remove the lump and give you and say, go and bury it or go and throw it away. Okay, so we're also educating doctors. So don't get me wrong that not all it is not all doctors that don't know what they are doing, but we want people to be well informed. We want people to be well informed, and there are some people who parade themselves now as doctors and are not doctors. Okay, so we want people to be well informed, to have better understanding of what is expected when a woman has a breast lump. There are some tests the woman is supposed to do. So access to care, access to quality care, knowing where to go, knowing the right place to go and what to do. Okay, so when we have that, and so we also have people who are in rural places, who are in distant places where it is not every oncologists are not even plenty in the country, and so it is not everywhere you can have access to an oncologist. And it is not compulsory that it must be an oncologist that will make your diagnosis. Okay. A GP can make your diagnosis, but we want you to go to GPs who who will take good care of you. Okay, who will not make your condition worse than it should be. So, and so when a sample is also sent to the lab, we expect that the results should be collected. You should collect the result. You should ask the doctor, what is written in the result? Is the result normal? Is it cancer? Do I need to take any other step? Do I need to do any other thing? So many people do not know this. They will just say, oh, they just took out the lump and they didn't go back to the doctor. When the lump now regrows, then they will now come and say, oh, that was when they now went back to the doctor, and the doctor now said it was cancer. Nobody notified them, nobody called them, and they didn't go back to. So we need people to be knowledgeable about all these things. So that's about access. And then we also talk about affordability, So some people are already diagnosed with cancer, and the challenge of treatment becomes a problem. Let me be honest with you, healthcare is not cheap. Quality healthcare is even more expensive. Okay, and so healthcare can be assessed in so many ways. And I'm going to talk this way so that we can have people have understanding of where to go and access healthcare. Okay, so government hospitals, there's some government hospitals that can manage the cancer and have access to government funding. Government funding, like government now has assisted programs for cancer patients, whereby the patient pays a certain percentage and government pays the remaining percentage to the drug. So, but you need to know where to go. So that if you go to those places, you can access those drugs and you'll be fine. We also have some NGOs who are into managing cancer. So if you don't come out and tell people who know about it, then they can't connect you with such NGOs who can help with treating your care. So the most important thing for any individual who has had a diagnosis of cancer is that that individual must come out and say, see, This is the result they have given me. I need help. And so when that person takes that step and says, I need help, then that help will come. So, but if you are in your house and then you are thinking, I don't have money, I don't have money, I don't know what to do, they have told me to go and do tests, so it's not going to help. Okay, so that is another challenge. There's also the challenge of stigmatization. So we still have a lot of our women who feel, oh, once you have cancer, maybe it's like, you know
A
how
death
stigma,
sentence.
yeah. So they think it's a death sentence. They can as well just go home and kuku go and die. It's not really like that. In fact, now we have so many sophisticated treatment options for cancer patients, and they no longer have to really no longer have to die because of the cancer. Okay, and so you can't have access to this if you don't come out to come and ask questions, to come and say what are your options, what treatment can you have, what can you do. And then people hear so many stories of, oh, chemotherapy will destroy all the cells in the body, radiotherapy will destroy all the cells in the body. Then when they hear that, they run away. Or even the one of, once you have cancer, they will remove the person's breast. So there's also the fear of mastectomy. Okay, gone are those days that where we remove everybody's breast. We no longer even do that. We don't remove people's breast anyhow anymore. Okay, except you come late. It is the person who presents late, who doesn't present early, that will have her breast removed. So, but people who come early, they can do what we call just removal of the lump and the surroundings of the lump. They can do what we call a breast conserving surgery, so that the breast tissues are removed and artificial tissue is put inside. They can take tissue from the person's tummy and put under the skin of the breast, and it looks like a breast compared to the other one. So, so many things are ongoing now in management of cancer, so that people no longer need to run away because of they're afraid of mastectomy, they're afraid of chemotherapy, they're afraid of the treatment. So much is ongoing. So these are some of the challenges that we find ourselves saddled with: misinformation, a lot of myths and misconception about what cancer is, and so all these things deter people from coming to the hospital to access care when they should.
Thank you very much. This is actually a masterclass that you've just given us now because you've just said it all. If you were observing my face when you said when you go to a doctor and say you have a lump and the first thing they do is want to cut it out, you might just be in the wrong doctor's hospital clinic. I
Exactly.
started
Exactly.
laughing because that's
Yeah.
exactly what happened to me. I've had
Mm,
3 lumpectomies, you
mm,
know, and luckily for me, they all came back benign. But I just went
mm,
and said, oh, okay, I feel like this wasn't here and it was here. And next thing was we are going under the knife. And funny enough, somebody called me and said, what's your, what's the alliance you have with going under the surgeon's knife? 3 times. What are
mm,
you looking for?
mm.
You need to decree, you need to bind, you need to, and and honestly, I just said, okay, I'm not going back anymore. I'm not even going to show anybody anything, or stuff like that. So, but at that point, that was all the information, and I thought I was woke.
Mm,
Woke enough to even go and say to a doctor, I'm seeing
mm.
something. But now you see, it's one thing to be woke, it's one thing to be woke the right way. So
Yeah.
thank you for what you've just said. I have just gotten new, fresh knowledge. And then, of course, when I'm sharing, because the truth is that we all learn by word of mouth. And then,
Mm.
what we share among our tribe, our family, our friends, our communities. So when I'm sharing now, I will share this new knowledge that I got today. And
Oh,
so the
please,
people that I'm
please.
talking to will also have better information going forward to be able to manage their stuff. Um, Let me put this here, as simple as this sounds. The doctor that can treat cancer is an oncologist,
Yes.
so that we don't just wake up and say, oh, I went to a doctor. A doctor that is specialized to treat doctor is known as an oncologist. So if you have cancer, you should be looking for an oncologist. One thing I've learned is that when you find a specialist, they break it down for you, and then you have better knowledge, and then you're better mentally prepared for what you are up against. Thank you
Exactly.
very much, Doctor. And I'm looking at the stream. There's a lot of thank you, Doctor, going on in the stream. So that means that you're actually connecting.
All right.
All right. So, Doctor, please, could you tell us what is this word? What is this thing, psycho-oncology? And what part does it play in a holistic treatment approach for cancer patients. When I
Yeah,
was
so
growing up, we are told that doctors do not do any other thing other than give you medicine. But now we're seeing that doctors are putting our psychology, our emotions, and everything into our recovery from very serious health issues.
yeah, so psycho-oncology has to do with the mental health of patients who have cancer.
Mhm.
Cancer is not a good news, okay? So I will not sugarcoat it. It's not a good news. So having said that, nobody is going to hear that he or she has cancer and we go to sleep like they just told the person has malaria.
Even malaria kills. I just lost a friend.
You understand? So not to not talk of hearing the word cancer. So what that word means is that the person's life is going to change for that time because he has to be on treatment, he has to do some things to get himself well. So he can't just afford to go home and go and say, oh, there's nothing wrong with him. Okay. So we need to understand that so patients who have had that kind of diagnosis have mental distress. And so, because they have mental distress, people react or handle mental distress in different ways. And so, psycho-oncology helps us to see how we can help the person who has been diagnosed to have a better perception of himself, of the disease he has, and how to handle it. Some people, when they hear the diagnosis, they are in denial. They say it's not my portion, no, and then they will go home and they will do nothing. So it's good to have faith. Okay, it's good to have faith and believe that, oh, God is going to take care of it and the person will be fine. There's nothing wrong in having faith. I believe in having faith. So but I believe also that you can have faith that you will have the treatment and you will be fine. So it's another thing to have the treatment and not be fine. Not every case is successful. So why don't you just apply your faith and say, okay, I will do whatever the doctor says, and I will trust God that God will make my healing perfect. So, which is also something you can have faith for. And so when we look at all the things related to it, it's going to involve money spending, it's going to involve time. So it causes a lot of discomfort for the individuals who are affected with cancer. And so there's a part of it that takes care of their mental well-being, and that is the psycho-oncology. So some of them may have to visit so we have people we call either the psychiatrists or the psychologists, who are people who deal with mental health issues. So it doesn't mean that the person is running mental kolo, the way we call it. Okay, no, it doesn't mean that, but it just means that the person needs some form of help so that the person can sleep well, can have less anxiety, can have a better understanding of what the treatment is all about, and can still live his or her normal life without feeling that he's going to die the following day. Some patients can have treatment without treatment for 2 5 years, nothing will be wrong with them if it is a slow growing one. Okay, so cancer speak different languages, but you don't know the type of language that person is going
Mm.
to speak until you get.
Mm.
So
Cancers
some
speak
people,
different
oh,
languages.
they speak different languages, different
So,
words, different languages. They behave
so
differently.
it all depends. One can be slow growth, one can be aggressive. Oh, wow.
Breast cancer speaks multiple languages. Different breast
Mm.
cancers, we speak different languages, and that is what helps the oncologist to know. And that's why we appreciate when the patient goes to the oncologist, because the oncologist will understand the language that this particular cancer is speaking and will be able to inform or advise in a better perspective than any other doctor will. So I think I have answered that question. So that's what
Absolutely.
psychology is about, mental health for cancer patients.
Absolutely. I'm going to come back to that line of discussion, but I want to quickly ask you, what are sarcomas?
Well, sarcomas are soft tissue cancers. So when we say soft tissues cancers, like like cancer can affect any part of the body. The only places cancer cannot, you cannot have cancer of the hair, you cannot have cancer of the teeth, you cannot have cancer of the nails. Okay, why? Because those three things I've mentioned are dead tissues. The hair is a dead tissue. Once it comes out of the skin, it's a dead tissue. It only grows from inside. Once it's outside, it cannot grow. It's a dead tissue. The nails,
Hmm.
once they come out of the person and they are coming out, the place where that turns white that we trim off is dead tissue. It does not have life in it. The teeth as also is dead tissue. Okay, so you can't have cancer there. So when you say sarcomas, sarcomas are like soft tissue, the muscles, that the muscles, the bone, okay, they are put into that category. So any cancer that comes from the muscles or from the bone is a sarcoma. So that's what sarcoma is.
Thank you for this because you see, from my own knowledge, I thought sarcomas were the aggressive ones, the ones that speak the aggressive
No,
language.
no, no. So
So I'm
sarcomas
very
comes in
happy.
different form. We have osteosarcoma, we have rhabdomyosarcoma, we have synovial sarcoma, we have soft tissue sarcoma. So sarcoma too comes in different forms. It's just a broad name for the category of cancers that come from either muscle, whether soft skeletal muscles, smooth muscles, whether bone, whether the joints. Okay, it's just a definition for cancers that grow from in those places.
Thank you, Doc. Thank you. I was praying before the show that you're not going to do the medical jargon with us, but that's why I'm like saluting
Trying
you
to
so I
break
can
it
just
down.
come down a bit. Yeah. Okay, great.
I'm trying to break it
So
down.
yes, something that happens in our society is once someone is diagnosed with cancer, there is sometimes, or more often than not, without even realizing it, the immediate relatives, maybe family, friends, kind of, I don't know if they're in shock or they are in denial, but they transmit rejection to the person that has been diagnosed with cancer. And the person begins to feel alone, you know. Um, Many years ago, I used to visit the cancer ward in LUTH, in Lasuth, not LUTH, in Lasuth. And I remember a particular case. She was there. Her breast was infested with a lot of wounds. It was oozing and everything. There was nobody caring for her. My friend and I used to go bath her, clean her up. The nurses weren't even coming near her. And eventually, when she died, nobody came forward. It was my friend and her NGO and us that went to go and bury her somewhere in Ikorodu. Family disappeared. She died
Yeah, so
alone. She died.
it's
She
so
died
sad.
lonely, alone, and very sad. And that is actually the the plight of many. you
Mm.
know. So when I saw psycho-oncology, I was really very happy. And then when I saw holistic approach to all of this, I was really very happy because there's a place for support in someone, getting well, having support and all of that. So can you please share with us if you've had any experience or a case where combining emotional support with medical care made a noticeable difference in a patient's recovery? So that
Okay.
all of us on this stream, well,
Yeah,
women and some
yeah.
men, will know to show care to anybody going through.
So that's part of what psycho-oncology does. And psycho-oncology is becoming a big thing that we're really embracing now. It has always been there. So, but because we're so carried away with so many things, and you also need expertise in this field to be able
Mhm.
to incorporate it. And so it takes care of the family support of the patient, the total well-being of the patient. So you'll be able to sit down with the patient, ask questions as to how the patient is feeling. Is the patient having anxiety? Is the patient angry? Angry at who? Is the patient afraid? Somebody needs to sit down and listen to how the patient is feeling. So it's not just about the patient enters into my office and make a prescription and I say, go and take the drug and come back again in 2 weeks. So you want to actually sit down and know how his mental health is. How is it at home? You want to get social workers for the person. Social workers are people who work in hospitals, and they come to have a relationship with the patient, visit the patient at home, see how the patient is living, give advice, care from time to
Mm.
time. Okay, so all those things come into play, and that is what part of psycho-oncology does for the person. So I'll give an example of a young lady in her mid 20s, you know, um, and so she was about 25, 26, and she had a diagnosis of breast cancer. And so you can just imagine somebody who is not married, who didn't have a stable job, who was living with her parents, and the parents were not really well to do. And so the first thing that came to her head is suicide. So she felt, of what benefit is her being alive? Let her kuku just kuku die now, so that she doesn't have to wait till when the cancer will kill her. She can as well just make it quick. Okay. So but it took us paying attention to what she was saying. It took us reading in between the lines for us to get what she was saying and what she was up to. But if she had just been a patient who came to the clinic and we wrote drug and she would just go home, nobody's paying attention to her, then she will commit suicide. And this is somebody who 5 years after is still alive, you know. And
Can
so
you
we
imagine?
had to get an NGO to support her. The NGO was giving her daily monthly allowances for feeding. You know that will go a long way to help her. The NGO supported her drugs, and she had access to, with the healthcare professionals, she had access to a psychiatrist who was able to put her on some drugs that will reduce her level of depression. And we're able to monitor her closely, and we had to involve our family members, so that we can get support from them, so that they don't leave her alone and they don't abandon her. And she's doing fine now. So this is some of the things, the good work psycho-oncology is doing, and is helping patients to come out of whatever it is, whatever bad responses they have gotten as a result of their new diagnosis, is helping them to come out of it so that they can survive. So some cancers, just like when I was saying, some cancers, 5 years, even if the person doesn't take anything, the person will be fine. You can imagine that person having that diagnosis and then decides to commit suicide. The cancer would not have killed the person, but because the person just heard the diagnosis, so he's terrified, he's afraid, he's angry, he's in denial, he cannot just accept the news because he has heard, oh, cancer is a bad disease, it will kill, you know. So, but that's the place of psycho-oncology, and everybody or every patient who comes to my center will have a psycho-oncology evaluation to see what distress level that person is, and to see if that person really needs help or intervention. Some patients, even when you identify that they need help or intervention and you say, oh, you have to see the psychiatrist, they say, no, doctor,
I'm not mad.
you know, in the Western world, they see psychiatrists like anything. Once they don't feel good with themselves in a day, they ask to see a psychiatrist and just to talk to the person. So sometimes all the psychiatrist does needs to do is just to talk to the person, explain more in details what is happening, reassure them, allay their fears, and that is all. So, but in this environment, if you say you need to see a psychiatrist, they tell you, ah, doctor, don't worry, I'm okay. Just let me go. I'll come back another day. You know, so you have to persuade them and let them know that there are benefits to it, because every patient who has a diagnosis of cancer will have a mental distress. There's just no how to it. So, and the person will need help. Some people are, thank God for some people that have, or maybe spiritual backgrounds, of because of their faith, they are able to say, oh, okay, I will get through it, I will cope, and I'll be fine, you know. But some people do not. So the level of how we get distress is it varies. People are so emotionally involved and afraid, and they really need help. So in different ways, that's how we tidy them up to see how we can help the patient. So, but that's an example of somebody who would have committed suicide, but psycho-oncology was able to help her emotional and mental state.
Thank you very much. We recently just held a conference. Um, that was the theme of the conference was Through the Fire, Triumphing in Adversity. And we had a speaker all the way from the US who is a two-time cancer survivor. And she said one thing that has stuck in my head ever since: do not grieve a life that isn't over. And your story now just buttressed that point. If
Yeah.
that lady hadn't had your team giving her the support she needed, holistically, medically, emotionally, psychologically, and otherwise, she would have died herself.
Yeah,
And it wouldn't have been because of cancer.
we wouldn't.
Because today you're telling us that she survived. So,
She's still alive.
so you
This
see,
is more than 5 years.
so we need to normalize going to see this specialist. There's nothing, it's not, you're not crazy, you're not mad. You could be mentally fatigued, you could be emotionally drawn out. You just need someone to handhold you and walk you through the ropes, like doctor has said. So please, my fellow women, let us not be doing super women with our life. It is when we're alive that we can do all the things we want to do. Doc, as you're sharing, I'm just busy asking myself, what even took you on this road? You did not see
You
you
know,
did not see you did
coincidentally,
not see
somebody
GP.
also asked me yesterday, and I was just laughing. Yeah.
You did not see GP to be giving malaria medicine and Panadol. And you're going
somebody
into
has
all this.
somebody has to do it. So that's my own calling. That's what God called me to do. So somebody has to do it, and that's what I've been called to do. And God is
So
helping
how
me.
do you, because you must be involved. How do you
Yeah, so that's part of the psycho-oncology, okay? So the psycho-oncology also has to do with not just the patient, the family members, and the doctors. Okay, so even the family members also need to have psycho-oncology evaluation. They also need to be attended to. In fact, it's like some people, there's an idea that they say that it's the person that is taking care of the sick person that is even more, that needs more help, that because that's the person that is more stressed, so they also need help. And likewise the doctor. So we also have emotional breakdown, we also have burnout and what have you. So but we also get attention from time to time to take care of our mental health. So we're fine, don't worry.
mm, mm.
So it's not easy, but we thank God. God is helping us, and somebody has to do it. Somebody has to be there for the patients. So somebody just has to do it. Yeah.
Okay, great. Well done. We can only just keep praying for you.
Thank
And
you.
I'm believing the best for you. Okay.
Thank you.
So many
Thank
of my
you.
listeners here, especially those ones that have loved ones battling with cancer, are sending in messages. I'm looking at them. They're actually curious to know more about how caregivers can provide the emotional support and complement medical care. What advice do you have for caregivers? In fact, you
Yeah,
even
so
just talked about them now. It's almost as if it's on
yeah.
cue.
Mm. So caregivers must be carried along at every stage of the patient's journey. Some patients will be lucky and will survive. Patients, some patients will not be lucky. And those patients who are not lucky, the caregivers must know so that they can provide emotional support for their relative, so that they will make sure that the patient at every point in time is comfortable, free of pain, free of discomfort, can sleep, can eat, all those things. And so the caregivers also will need, because this is a chronic illness. When we say chronic illness, is an illness that is not going to go away in 2 weeks. And so the caregivers must also be prepared to understand that they will have to provide this care for a long time. And so if they're going to provide the care for a long time, they must make themselves available to the person. How they will do it, they will have to restructure their own life as well, because somebody must be there for that individual. And as much as possible, we try to help them so that they don't develop the habit of now saying they want to abandon the person or run away. Okay, we make them to see that there's a brighter side to it, and this person will forever be grateful for whatever assistance you render to him or her. So the caregivers also have a huge role to play. So sometimes there's some dressings that needs to be done, wound dressing. We teach them how to do the wound dressing. You don't have to bring the person to the hospital. That means you will not go to work. You will not go to work because you have to come to Luz. Maybe they are living in the Ikorodu, and then they have to drive down to Luz, and then they won't go to work. And so they'll bring the patient to the hospital, take the patient. I said, so some things are basic. So if something like this happens, this is what you need to do. You can change the nurses will teach you what you can buy, will write it for you, you buy it. This is how you change it every other day. Okay, if she's vomiting, use this drug. If she's not vomiting, you don't need to use it. If she's feeling excessively, use this one. So we provide enough information that can guide them or help them to also do some basic nursing care at home without having to come to the hospital every time. So just like I said, it's a chronic disease, it's a long-term thing, and they would need to also be available to help the person. There are some patients who, especially the elderly ones, I tell the children, I say, come, you don't need to come to Lutz every time Baba calls. There are some basic things you can do for him, and such that you don't have to bring him. We give them a telephone line, or we tell them, is there a nearest primary health care
Healthcare.
service available near your house, or you have a private hospital around you, such that if you run into any crisis, you can just go there, put a call through to us, we speak to the doctors there, and we tell them what to do for Baba, so that you don't have to leave your house and go to Baba's house to bring Baba to the hospital, and then your own life too is just turned upside down. And most often times they are usually very grateful when we make this available to them. So just like I said, it's a chronic thing that the care has made be for a long time. Remember that it is not all patients that end up like this. Patients who come early do not end up like this. Patients who come
Yeah.
early, their treatment is completed. They just come to smile at you every 3 months or every 6 months, depending on how the appointment is. I just came to say hello, Dr. Alabi. Everything is good, you know. So it is not all patients that end up having to need long-term care like
Yeah.
this. And so that's why we are preaching early detection, prevention, whatever you can do to make sure that you don't get to that level.
Okay, great. I have another question here. It says we often hear about survivors needing to address trauma long after their medical treatment ends. How can emotional support help cancer survivors maintain their well-being post-treatment?
Okay, so to do that, we have some survivorship groups. So just like we are saying stigma in this our environment, many people do not come out. Okay, so but if I look back 10 years ago and see where we are now, I think we've made a lot of progress
Progress.
even in that regard. So we now have survivorship groups where people will come out and they will even tell me, Dr. Alabi, if you want me to come and talk at an event as a survivor, please give me a call. You know, we now have people like that. So people are not longer shying away of, I don't want anybody to know, I don't want this person to, I don't want my neighbors to know. People are shying away from that. So we have a lot of survivorship activities now. And if there's any survivor that needs help, honestly speaking, I will not say that I have come across survivors that are still so much in trauma. I don't think that is. I don't think that's a major thing. Okay, so but if at all there are, then they also have access to seeing the psycho-oncologist. Okay, the psycho-oncologists or the psychiatrists, they are there for everybody. NSIA-LUTH Cancer Centre has a very strong psycho-oncology unit where you can walk in, book appointments. That's all you just want to see the psycho-oncologist so that you can have your mental state checked and see if you need drugs. Sometimes they need to put the person on drug, which will actually help them to feel better with themselves and get well. And so sometimes they may need drug because the trauma is huge. You can imagine a woman who has lost a breast and every time she's dressing up, some women cannot cope with that trauma. Some
Yeah.
cannot. I've seen a woman
Coming to
who
terms with their new body
no,
image.
no, no. She just could not cope with it. It was very, very demoralizing for her. And some women will tell you, Dr. Labi, let them remove the two breasts. Now, what is she doing with the breast? If there's no breast, there will be no cancer. Let them remove everything. So we handle circumstances in different ways. We don't handle it the same way. So some women, it's every time you see them, they are still looking demoralized, they are still looking down. So such women, we need help. So that's what I can say.
Family dynamics also plays a very major role in how women get to um, respond to having their breast cut off. I do know of a situation where a woman lost her breast and her husband couldn't deal. He couldn't deal. That was the end of any intimacy, end of anything at all.
Yeah,
So they
so
were,
we have quite some men like that. I've seen men who brought their wives to the hospital and said, "Doctor, anything you want to do for this woman, do. You want to give drug, but don't remove the breast." I've seen men like that. So eventually the wife will die. Okay. Yeah. So I've seen women like that, and well, the wife does not really have to die. If they come early, we can salvage the breast, we can save the breast. We save a lot of breast now. We don't remove so many breasts as we used to do before.
But
So
don't you
but
think there's something wrong with somebody saying, if removing my wife's breast can save her, don't remove it. I
okay.
prefer that she
So
dies. And the
so
woman
so
agrees that she
I'm
will
sure
die.
that I have raised another question for you to do another show on. Don't call me anyway. So I've raised another question for you to do another show on, and one of my doctors will say, "Is it your breast or your life?" So would you rather have the woman's breast, or you want her life? This man made it categorically clear it is either the breast or he's not doing again. And the wife too agreed. And so when the wife agreed,
No.
what would the doctor do? We can only, we have need
Ah.
consent from the woman to say we will treat. You understand? So these are difficult dilemmas of some things we go through. So this one, I have seen one happen, in fact, more than one, that the man will say, if you remove the breast, it's a no-no for him. He's not doing again. So
So
these
I will choose me, Ezinne Ekufre will open my eye and choose to die as Mrs. Ekandem with two breasts instead of living as
are.
Mrs. Ekandem
So,
without
so you
breast.
can see how bad it can get sometimes. Yes, you
You're
can
right.
see
We're
how
going to do that
yeah, yeah,
show, Your Breast or Your Life. We're going to do that show. Um, okay, so it therefore means that we need to just keep doing the public awareness.
yeah. Yes, we do. Yes, we do. We really need to keep doing it.
We isn't, yes, the progress we've made, we need to improve on it so that, people become even more aware and choose life over aesthetics.
Yes.
Yeah.
So I'm
That's,
sure, because like the man I gave example, he eventually lost his wife. I'm
mhm.
sure if he retrospect, I'm sure if you ask him now, he may feel he didn't make the right call, but it's too late to decide to be saying that. You know.
Exactly. It's important that you make the right call when it is important, not
Mm,
after, you know.
exactly.
Yeah, because I mean, if you're dead, you're dead. Can be done for you, but the thing is to make sure that we don't die. Okay, so
Mm.
somebody said on the stream, live first. Who owns the breast, the man or the woman?
That one, I told you, I said, don't call me on the day you want to do this one. Okay? So because the honest truth that they both own the breast. Both the woman and the man, they both own the breast. So on whose side you actually want to be on now, I don't know. So I will
Oh
not
my
be the
god.
one to enter into that debate, but they both own the breast. And so you have to come to an agreement on what treatment you have to do, or else the doctor is in trouble. The doctor that removes the breast will be in big trouble.
The
So
truth is that there is no linear, there's no straight line to anything. In life, something must come to complicate something. You might just think that, okay, it's your breast, you're carrying it on your body, but I mean, come on, look at what we're hearing today. Dr. Alabi, it is
for some
amazing.
some women, it is their husbands that made the diagnosis of breast cancer for them. A
Oh,
lot of
yes.
women, it's the husband that will say that he found the lump. The wife did not know
Mm-hmm,
there was a lump.
mm-hmm,
So you see
mm-hmm,
that the two of them own the breast.
mm-hmm. Yeah,
Uh-huh.
you're right. You're
So I
right.
have I have to speak for the men. Mhm. Because they've
You're
done
right.
they've done a lot of work for me by helping me to fish out the lump in their wife's breast. So we
And
must
send
give
their wives
kudos
to
to
you in the
them.
first
And
place.
some of them, honestly speaking, are fantastic supporters. They will follow their wives to every clinic appointment, every treatment appointment. They will stick close to their wives. Some men are fantastic supporters, and those are the kind of men we need to help the woman in the journey of facing breast cancer and fighting it well.
Thank you. Thank you very much. Earlier on, when you were talking, you said Ezinne needs to go out and advocate some more, and you are absolutely very right.
Yeah.
We need to carry this message all the way down to the grassroots, interpret it in all the languages that we can to make sure that women get it. We need to start catch them young, go to schools, catch them young, and then carry it and everywhere, and just make sure it's all over the place. Because the truth is, the statistics are not friendly and are not smiling. And every day you learn something new about cancer. Today I'm going away with cancer speaks very different languages.
Language.
And so we need to also make sure that women understand this. It's not enough for us to just wake up and do nothing and then come into October and say Cancer Awareness Month. And then we dance for 31 days, 30 days of September, 31 days in October. And then we now say, okay, till next year. This is an advocacy that we have to do all year round because every day women are dying.
Mm.
They are dying. We may not know why, but I think we're beginning to know that most of it is cancer related. Also, because of the way we are, we internalize our traumas and our emotions and everything. And so we need to find outlets for these things so that we can live long and live well. Funny enough, some people will tell you that the men are dying and there are more widows around, but either way, we need to take care of
Of
ourselves. So, just
exactly.
before we wrap up this conversation, Doc, what message do you have for our listeners who may be struggling with the emotional weight of cancer diagnosis, whether it's their own or someone they care about? Earlier on, you said it takes 3 weeks. My God, the wait can even kill you. I've had to wait for results. You see that 3 weeks? You can emaciate, you can die, you can resurrect. I mean, in fact,
Mm.
that when you eventually, someone like me, when I eventually got my own diagnosis and I was in the clear, I fell on the ground in the doctor's room, doctor's hospital. I fell on my knees and I was just dancing and worshiping. And I'm sure the man was like, what's wrong with this woman? But I alone know what those 3 weeks wait was
Right.
like. So, what message do you want to leave
Okay.
with those of us?
So remember, I said the theme for the Breast Cancer Awareness Month is you do not have to face breast cancer alone. You have more than enough support. If you don't have support around you, come to the hospital. We will find you support. More than enough support. People that will make you happy. People that will make you see life worth living for. Okay, and the support is in so many ways. Sometimes I just finished seeing a patient and I've just finished telling her the diagnosis and all the treatment, and then I mentioned, oh, you're going to have surgery, and she breaks down, and maybe coincidentally I have a survivor outside. I'll just hug one of my survivors and say, come and help me talk to this person. By the time they both go together, come back, talk, and they'll be all smiles and be like, doctor, can the treatment start today? So we try to see how we can get support, emotional support. We try to make sure we make it available for our patients. We don't want anybody to go home and feel that he's been confined to a life of of stigma, of being abandoned, of death. No, we don't want any patient to feel like that. By the grace of God, we are trying our best, and we know that God is really helping us. Treatment has advanced to compare to what we used to do or 10 years ago. Treatment has advanced. So the chances of people surviving now is higher, but people need to come early. We need to do early detection. You need to listen to the doctors, do whatever they tell you to do. Okay, some of these things don't come easy, they don't come cheap, the side effects and everything. But somehow, patients will overcome and they'll get well and they'll be fine. So we try to make sure. So don't stay at home. Whatever trouble it is, see your doctor and let your doctor know and see how they can help you. Emotional support is very much available. The survivorship groups are there. People are coming and helping themselves, encouraging themselves. They will even form WhatsApp group. I'll be talking, and then you will get to stumble on, and you'll be like, you people have even become more friends. Am I not the one that introduced both of you to each other? You people have now become more friends, and you have put your doctor aside, So, but we're happy to have that, So just to see how we can make them keep life going. Some will come and will say, oh, they don't feel like going to church again. They feel, I said, what are you in church? What do you do in church? Oh, she said, oh, that she used to take the children, that even the children they are asking. I said, if there's anything you should keep doing, whatever you were doing before, do more for yourself now, and that way you'll be fine. The next time I saw her, she was all smiles, and so we just try to see how we can help. So don't let this be a life of it's over. No, it's not over, except you want to write it that way for yourself. Don't make it over. Let it be a life of, this is a challenge that you will overcome, you will run and you will overcome, and you become a champion. So that's the way I want them, all cancer patients out there, to see it.
Okay, I know we are wrapping up, but something just came in and I need to read it out to you, Doc. He says, thank you, Dr. Alabi. I know a young friend of mine whose mother died from untreated breast cancer because her dad was covering it up, hiding her from family members. This lady is a doctor today and married to a doctor. Her husband supported her taking out her two breasts, and this is done to avoid getting breast cancer. She has two children and she's doing great. What a testimony to be closing
Yeah,
out with, you
yeah.
know. What a testimony. Thank you very much for sharing, Biodu Oluwake. Thank you very much. And thank you so much, Dr. Alabi, for your incredible insights
Thank
today.
you. Thank you.
It's been an
Thank you for
honor to
having me.
have you on the show. And I'm
My
going to
pleasure
say
to
this
be here.
to I'm going to say this to my people, everybody on this stream. Dr. Alabi said it does not have to end in death sentence. No, except if you want it to be so. She said that medicine is so advanced now. There's so much they are doing now that cancer doesn't have to be a death sentence. So it therefore means that it's a choice that you and I have to make to either go to the hospital early and meet Dr. Alabi and get cured. Don't worry about money, like I always tell people. What's the cost of life? That should be the first one. And in everything that Dr. Alabi said today, she made us understand that government has some interventions that they do. And of course, the NGOs have some interventions that they do. But you must be in the hospital, you must be seen for you to get these interventions. So I will say, do not die before you die. Cancer isn't a death sentence. And so let me thank everybody who came on the stream. And I'm also thanking everybody who will come and watch later on because it will be available for you to see. As we bring today's edition to a close, remember that cancer treatment doesn't end with medicine alone. There's the emotional and there's also the psychological support, which are also very important. And at Doctors Center in LUTH, they take cognizance of this. See, don't say I don't do anything for you. I have introduced all of you to Dr. Alabi. When you get to LUTH, please mention that you got to know about her from Up You with Ezinne. You will definitely get quick access to her and get your diagnosis done. But that is not to say that she doesn't give every other person quick access, though. I'm just trying to, make myself feel very important. You know what I mean? So let's work together, everyone, and close the care gap. From everything that doctor has told us today, we don't need to be flying abroad. We don't need to. Everything is coming here. Everything is already here. I mean, when I was reading her profile, I was intimidated. Very. She is so versed. I told you guys she's one of the bestest oncologists we have in this country. She's so versed in the stuff. And you heard her when she said, this is my calling. So this is not a job. This is her calling. She's invested in it. So you don't have to go abroad if you don't have to go abroad. You can get all your treatment here. But please do all of us, including yourself, the favor of coming out early. Yeah, you see, you didn't give yourself cancer. Even if it's possible that you did, it doesn't really matter. The important thing is that you save yourself and stay alive. So in this October, please make sure you go get your examinations done. Be breast aware. Check your breast. Do your mammograms. Take your vaccines. Do all that you have to do to ensure that you live. That is your primary assignment in this world, to ensure that you are alive. Because it's only when you are alive that you can actually do all those dreams that you carry on the inside and all those projects that you want to do and become everything that you want to become and travel to everywhere you want to travel to and achieve all that you want to achieve. Dead women don't do any of this. So it's important that we stay alive. Okay, if you missed any part of today's show, please catch the full episode on our YouTube in a few hours. And then please make sure you follow at UpYouWithEzinne on all platforms to stay updated on our next powerful episode, which Doctor has even highlighted. I think we are going to look for someone to have that discussion with us. Your breast or your life. Okay? All right. Until next time, my beautiful people, stay strong, stay empowered, and keep lifting each other up. This is Up You with Ezinne, and I'm signing out with Dr. Alabi. We're saying, Up you.
Thank you. Help you, everybody. Help you.
All right, bye.
Thank you. Bye.
Doc, enjoy the rest of your day.
I will. Thank you.
All right, bye.